who are you?
Who am I? I'm a strength and conditioning coach. I've been working in the industry for just over 2 years now in fitness. Specifically, at this stage in my career, I specifically help women. I do so because my entire life changed when I started working out consistently. Whereas I didn't really know much about what should be a structured routine for me. I didn't know how to like procure a fitness experience like that. And then post-COVID, I learned deeply about tracking my nutrition, but also training hard in the gym. And I got results that were far deeper than I expected for myself. And so, yeah, I'm a strength and conditioning coach that really believes in how transformational fitness can be in somebody's life, and specifically for women. I want to bring that experience to them because I don't think women get enough education on learning how to make ourselves strong. So that's who I am. Those are my goals in the industry, and that's me.
It sounds like fitness is really important to you.
Yeah, it's deeply important to me. I think that there's something that happens when you start training consistently and lifting heavy specifically. I'm so glad that that's changing in our favor in the industry, that's becoming something that's normalized and promoted amongst women's health and fitness. It's life-changing. But what was I going to say? So I think there's something that happens at almost like a cellular level, sort of like a personality shift too, because you start to understand what like real self-care actually is, and you get a lot stronger as a person when you start to understand what it's like for your body to push through something hard. And then it's an undeniable effect when you leave the gym that you just feel. It's obviously part of it is endorphins. We want to get drilled down into the nitty gritty of what's happening in the body. Sure. We could, but I'm not going to. I'm just going to say,
I would prefer not to, actually.
On a somatic level, you know that you've done good work. You know that you've given back to yourself, and you know that you are becoming more resilient as a person. And that's what really changed for me on like the emotional spectrum of things. Yeah.
So it's deep. And you want to bring it to other people.
Yeah, but especially women though, because like, I mean, I won't go all the way down the road of like what kinds of issues women deal with on a day-to-day basis, but like it's it's quite a difficult existence to try to take care of yourself as a woman, and not get like led astray by lots of horrendous like fads, and also just lies about what we should look like, be like, act like, whatever. It's never ending for us.
Right. It's like contradictory messaging. Like if you do something that.
Contradictory is one way to put it. I think more like I'm referring to like toxic beauty standards. I think more so. I think that's way more pervasive for women than it is for men, and then it's just like. It's almost like, soul destroying. It's a really difficult procedure for us to just exist in our bodies and try to love our bodies as they are. And so like I want to bring that experience to women because it's not that I don't care about aesthetics. That's really not what I'm trying to say, but understanding what strong is and bringing that to your body is almost a way of like circumventing worrying about that stuff, because to be honest, those results come anyway for most people when you do train consistently, but also you get way more obsessed over time with what you feel like and what you can do rather than what you look like. And like, that's the journey that I want to bring people through.
So part of what I'm hearing from you is like, come have this experience with me. Mm-hmm. I could tell you stuff and that could be interesting, but if you come and do this, the experience that you have will be more transformative than
me telling people how to work out.
Yeah.
I mean, why not? Like, I mean, I'm gonna sell programs online like that. I guess I guess that's an option for
Well,
people.
it's a way of creating experience, right?
Yeah,
Like,
it is. It is. What I'm trying to build in this industry is actually an in-home personal training service for women. So I actually want to be able to hire multiple trainers, cover huge swaths of the GTA, and then scale bigger probably down the line, to be able to kind of bond with people over fitness, because I actually think the emotional piece and the social piece, if that is missing, people have a way harder time staying consistent. And I also speak from experience when I say that. So yeah, no, I think the fun of it, the love of it, the rush of all those things that are happening physiologically as you're training, I think those can be amplified by caring about, your trainer's perspective on things, being able to pick their brain while you're training, and just having a buddy in a sense, but also like a really well-trained, educated coach beside you.
yeah.
Yeah. So now, who are you?
I'm Pete. I'm a chiropractor. I've been working and helping people with my hands in some way or another for about 20 years. You just start doing it and then you get old. It's not actually that impressive. Yeah, I have a background. I studied kinesiology at university. I'm kind of, if I were to describe the perspective of my practice, I think that movement is the single greatest health promoting thing that people can do. I understand that people experience a lot of barriers to movement, especially when it comes to like pain and fear around physical activity.
Right.
And so I imagine my role is that I come and I help people remove those barriers so they can engage with the best medicine around.
Wow, cool. So break down a little bit about like the fear too, because you're rehabbing people,
Sure.
right? So
Yeah.
like talk about that. How do we get people past that?
I think there's a couple ways that you can get people past that. But I think they all kind of go down to experience. I understand that fear and pain and the way that pain and fear interact are congruent and appropriate based on people's experiences.
Okay.
So if someone had an incident where they bent down and they picked something up and they had a disc in their back herniate, it's really normal and appropriate for that person to feel fragile, unsteady, afraid of doing movements that might recreate that. Like, what a normal experience.
Sure. Yeah.
I think I understand that when we are bringing someone back from that place, from the place where they are injured or from the place where they've had kind of this big setback, what we're trying to do is create a stream of experiences where this person gets to experience bits and bobs of the thing that hurt them, be innocuous and non-threatening, and watch themselves develop power and capacity.
Nice.
And it's the feed forward mechanism of the experience, because it's like trust. Like if someone breaks your trust, you can't just say that you should trust them again. You kind of need to watch them engage in some sort of repair. You kind of need to watch them try to come back to you. You need to watch them kind of like show themselves in a vulnerable way.
You're wading them into the water, right?
Yeah, and so you're wading them into the water being like, no, this is safe.
Yeah.
And like, we're going to go as far as you're comfortable.
Exactly.
And I'm going to show you how far we're going to need to go.
I giggled because it's actually a therapeutic tactic, right? Like if somebody has an arachnophobia, like it's that slow exposure to arachnids over time, right?
But it's funny because it turns out that people are still people.
What do you mean by that?
Well, like the circuitry that comes, like the neural circuitry that comes online when someone is afraid of spiders is the same circuitry that comes online when someone's afraid of movement.
Right.
Like you're working with the same machine, you're working with the same operating system.
Totally.
It's just
Would it be the
being
hypothalamus? Would that be part of it? Is that what we're talking about right now?
Yeah, so in this particular case, we're kind of talking like so hypothalamus for learning that the stressor is the thing that's dangerous.
Right.
Limbic system for the kind of like non-fear emotions around the thing, and then amygdala for the fear, danger, avoidance signaling. And usually there's some amount of complexity, especially when someone's had pain for a long time.
Right.
So like if you've
That's
had
a
pain,
lot of systems firing up when you're about to do something.
and
Yeah.
you and I both know that when there are, so this is actually really interesting.
Yeah.
When you look at the brain of someone who is learning to perform an activity, like you do an fMRI, and you image what it's like for them to learn to perform a behavior, you'll see about 7 different brain areas online. When you have someone who's an experienced athlete performing an area, you'll see somewhere between like 3 and 5, depending on how engaged other parts of their brain are.
Okay.
And when you see someone who has chronic pain trying to perform that same behavior, you'll see like 11 to 17.
Wow. Oh my gosh.
Yeah.
That's crazy.
And so there is sort of this like, people do work better when you give them the experiences that let those other alarm systems come offline
Yeah.
so that they can do the thing with less. Like when you're learning, it makes sense that you have more areas active because you're like trying to figure out how everything works.
But meaning that like a client with like that much pain and fear, like you're not trying to throw them into the deep end.
Oh hell no! You're not giving them like Olympic cleans or
Right.
Yeah.
Those are fun though.
Yeah.
I'm sure we've both been like very injured in the past. So we're not just talking about this in terms of your work and what you do, but also like we know exactly what that's like to feel pretty useless, right? Like I had a QL tear recently from
hurts
from
too.
barbell back squats.
Okay.
It was brutal. And getting myself back into the gym, like there's that small part of your brain, there's this teeny little voice that's like, maybe I can never train again the way that I used to, right?
Yeah.
So that's actually,
For sure.
I don't know if you want to like speak on that a little bit, but there is even at, I'm sure like the highest levels of fitness, there's that little fear voice that's like, hey, maybe this is it for me.
Yeah.
Like, do you get people past that point a lot of the time in your work? Or
I mean, like I try to.
Yeah.
I think so. First, before we blow past that, I'm sorry. It sounds like a really shitty experience.
Oh, it was shitty.
Yeah, no, it
Definitely
sounds
shitty,
fucking
especially
awful.
because that's
Yeah.
one of my strongest lifts, and like,
Yeah.
pretty common for women to be crushing the barbell back squat like pretty quickly.
Yeah.
We tend to be, strong in the low
So, yeah.
body, so
Well,
we learn
yeah.
it fast, and like, but I've been working on it for, years and years, obviously, and just getting crazy strong at it. So that one moment where you feel that click, that pop,
that shift.
it's
Yeah.
just complete like terror and pain
Yeah.
floods through you, and then the aftermath, like the 3 to 4 day aftermath, where you effectively can't lift anything. It's like that first week of acute injury is so undeniably scary.
Yeah.
That you like, and
It's eviscerating.
it's eviscerating. That's a good word for it.
Yeah.
Yeah.
Gutted.
Totally.
Yeah. The mindfulness that I practiced, I feel like really comes in
Yeah.
where it's just like, I mean, if you can, so be it. Like, you might not be able to train the same way again. Yeah, that really sucks. Yeah, you're really afraid right now. Yeah, that really sucks. Like, you deserve comfort and care in that moment.
Right.
Ugh, feels bad. I think where that sort of, we'll call it like the mindset piece,
Okay.
where it becomes a bit more complicated is when you see people kind of enter a boom and bust cycle where they'll hurt their back real bad or they'll hurt their shoulder really bad,
Yep.
and then they'll avoid it for 3 months until
Right.
like the gremlins inside of them are have told them they're enough
you
of
need
a
to move your shoulder.
you need to, well, like, no, it's not you need to move your shoulder,
the
it's like,
opposite?
no, it's like looking at yourself in the mirror and being like, not enough.
Right. That
Right, like
voice,
like
yeah.
it's like the I'm
That's
not, yeah,
what I want
that's
to eradicate from women.
that's why I called them
Just that voice.
That's why-
Never listen to that. It's a lie.
that's why I called them gremlins.
Yeah.
I have such a specific perspective on this.
Go for it.
And
Go for
I don't
it.
know if it's helpful. So if self-acceptance is useful
Mm-hmm.
and debatable, I like it. I think it's like a nice way to live.
Sure.
I think so. I had a moment like this probably 2 years ago, where I hadn't been working out for a bit. I had just gone through like a rather rough breakup.
Yikes.
And as I look at myself in the mirror, my first thought is, man, your arms are looking really small. It's time to get back to the gym.
Oh, I hate that kind of thinking for us. But anyways,
For sure.
I have very strong opinions on this subject too.
Yeah.
But
And I will
yeah.
I will trust me, this gets better.
Okay, good. I'm listening. I'm all for
the
it.
story is terrible, but it gets better.
Let's find the uphill.
The second thought was, no.
Yay.
We're not going to do that.
Yay.
Like, we are going to identify, like, we're not going to work to avoid a negative. We're going to work towards a positive, and I want you to fuck off with that bullshit.
Yay, good.
And the third voice is, hey man, that part of me that you just snapped at is trying to protect me.
Right.
Right? It understands that my perception of my beauty is important for me to do a bunch of things that are really important. And like, yeah, he's mean and he's loud and he's snappy and he's me.
Yeah, for
right?
sure.
Like,
absolutely.
So
it's the shadow self, right?
Yeah. So it's like, thanks y'all for coming out. But I'm going to choose to be nice to me at every juncture.
Yeah, they need space to throw a tantrum, right? Like that old.
You're not big enough.
No, but really though, like it is talking to your inner child, right? They all deserve space. All of those voices. For a while, I had a very specific interest in dissociative identity disorder. Didn't think we were going to get here today. What a random tangent, but
we were supposed to talk about shoulders.
We were. We will get there. I promise. We're going to get there. We're going to get there. We're going to pause this in a second and go back to where we're supposed to go. But like, yeah. So DID. This. The idea behind DID is that you have lots of different parts that are separated at childhood because of trauma. So the brain doesn't fully integrate, so you end up with multiple personalities. Essentially, it used to be called multiple personality disorder, but it's not anymore. It was renamed a while back. And so, yeah, the way to deal with DID is not necessarily to try to have one cohesive personality again, because that's actually not attainable for some people, depending on who they are, what they've been through, what kind of support systems they have. Some people do get back to one personality and integrate all the parts. Some people don't. But the main driving principle behind like how people in the mental health world are theorizing how to tackle this disorder is just by like recognizing all of the parts and realizing that there are no bad parts. Like they all need space to speak, because if they don't get space to speak like that, you're essentially shunning them the way they've already been shunned, and that doesn't help. That only makes them more upset, and so they're going to be louder in a more negative way. If they're seen and accepted and brought into the room and brought into the conversation and talked to like part of the inner child, which they are, then they feel safe in your body again, essentially.
I really like because like I have a slightly different framework to talk about this, because I mean I touch people for money. There's I'm like, the level of depth that I need is not that level of depth. But like the way I understand it is that attentional signals have a job, and that job is to get your attention. And so any attentional signal, whether that's an emotional signal, whether that's a bodily signal, whether that's hunger, like you have mechanisms to repress them. You have things that can take them offline. Technology use, thinking a lot, like all that stuff does a killer job of just like turning down your ability to perceive those things.
Yikes, but yeah.
Sure.
Yeah.
I mean, look at how happy people are who use a lot of technology and think a lot. They seem super well balanced. I'm talking to you, Craig.
Who's Craig?
I don't know.
Okay.
I just chose a name.
Okay.
Actually, I know a Craig, not the one that I know, the other one who I've never met.
Listen up.
Yeah, Craig. It's gotta. But so I think like even without having to, like, I think I imagine that some people might run into a bit of a boundary around, the idea that they come in parts, or that they come in components. Yeah. And I think my alternative to describing that, which I think is probably like less accurate, but or rather it's less rich.
It could just be from a different lens,
too, for sure.
Right?
Yeah,
like
just different perspective over the hell.
More of like a different kind of clinical lens, actually. Yeah. They're both clinical, but whatever. Anyways.
Yeah, I guess so.
Cool. So that's a little bit about who we are.
Yeah, in more depth than y'all probably needed.
Yeah, that was a hell of a tangent, honestly. So I have a ton of questions, not questions, I have a ton of clients with shoulder mobility issues. Okay. And something in strength training that is extremely important is pressing, not just overhead, but in multiple planes of motion, right? So I have a lot of clients where we'll do a mobility test and we'll get them on the wall doing wall slides, and the wall slides will be, for lack of a better word, like bad, like
limited,
limited shoulder range, like really limited shoulder range. And this is just so common. It's just so prevalent. And there's obviously a bunch of different reasons for this to happen. So can we talk about maybe what are like the main causes that you see in your practice?
Sure. I don't know if I have necessarily a ton of insights into cause.
Okay.
Like, I think I could describe the things that are happening that restrict the range of motion.
Mm-hmm. Maybe let's talk about that then.
And that's maybe like cause is sort of, I prefer not to think about it very much.
Because it might not matter, right? When we're trying to help somebody get better, what really matters is like how often we're working on the issue and how we choose to work on the issue based on maybe like, how long it's been since the injury happened. There's lots of other things that are important to tackle here rather than just like what happened to the shoulder, more so how does that manifest in the body.
Yeah. So I think lat, just like a restriction in terms of the person's ability to use their lat. So if you were to like put their back up against the wall and have them reach over their head, how high can they get without, so if they can't get past 90 degrees without their back coming off the wall, that's a sign lat tightness might be there. The baseline anterior humeral head carriage. So I want you to imagine if you looked at like the glenohumeral joint from the side, that's the shoulder joint. You could imagine the head of the humerus kind of in a normal person lying somewhat smack in the middle. And some people you'll watch walking around and they'll kind of have this presentation.
Wow.
So you'd see like the tip of their shoulder be somewhat in front of their elbow as they walk. So it's not just like whether they're protracted or retracted.
So it's not necessarily kyphosis then?
Yeah, so the thing is that a lot of people have both. A lot of people will have that kind of anterior humeral head translation.
Right.
Paired with a scapular protraction, paired with the hyperkyphosis.
Right.
Because each of those are kind of like independent variables.
Okay. Wow. Okay. Yeah, that's a lot going on at once, and I'm pretty sure I can think of like 5 people that I'm working with that kind of have mirror that. Yeah, for sure.
Yeah. And then I would say that like the last piece is kind of the control piece. So is there adequate scapular tipping and upwards rotation as they bring their arms up overhead? Is there adequate engagement of the rotator cuff that keeps that humeral head centrated and out of the... So there's like 11 millimeters of clearance in a healthy shoulder joint between the top of the head of the humerus and the acromion.
Okay, is that like filled with like the synovial fluid? Is that where that is? Or
so that's filled with a bursa and the tendons of the long head of bicep, supraspinatus, and subscapularis.
Oh, that's where the tendons...
Yeah, so that's where all the tendons sit.
Okay.
And then there's some amount of space.
Okay. And that's what a healthy shoulder looks like.
And like unhealthy shoulders where if there's tendon tears or dislocation, you can either have more space of the shoulders like dislocated and hanging forward, or you can have substantially less space as the joint becomes, as the acromioclavicular joint becomes arthritic.
Okay, so what do we do if we're working with someone with like, say, all those three things, and then a tear? Like, let's talk about that.
So we're talking sort of about like an older person.
Predominantly, those are the people that tend to show up with those issues. And I'm sure that like the sitting during the day isn't helping, but like, you don't really know necessarily where it comes from. But again, to circle back on this idea, it's not going to help me at all to really understand where it comes from, but I do need to understand how to rehab it, because I get told a lot of the time that people like this can't press at all, right? Not at all. Not forward, not here, not here. Just so like we're immediately restricted from like tons of basic movement patterns, right? So what do I do with someone like this?
So I'm going to make the assumption that these restrictions are self-reported restrictions, as opposed to like this is a person feeling like they can't push or press or lift without having discomfort.
I mean, some of, let's say there's discomfort, but also, and there is most of the time.
Yep.
But also like when I'm watching them press, for example, like there's no, like in an overhead, even if we tuck in the elbows, like there's still a lot of trouble actually just getting there. So just even the movement, maybe not pain necessarily, but just
the
full-blown restriction, I guess.
So I think this is where, if we're going for like the simplest answer.
Sure, let's start there.
Technique selection. The way I would think about it is like, if I say scaption.
I mean, I think protraction, retraction, that's like...
Okay, so
what I think about.
If you imagine the range of motion if you imagine how the shoulder blade rests on the body, it kind of rests on about a 30-degree angle.
Right.
So if you think about like my maximum amount of shoulder horizontal abduction, I'm actually at the end range of the shoulder here.
Yeah.
Scaption is sort of like this 30 degrees forward. I like to think of it as like,
it's almost
if
like
you're
neutral
if you're eating
shoulder?
dinner. Yeah, so this is like the most neutral shoulder position.
Okay.
So thumbs up raises, neutral raises are probably like the two easiest starting points within a range of motion that is non-provocative.
Okay, so with weight, like holding weight, like
Maybe not.
okay,
Right,
wow.
like depending on how messed up the shoulder is.
Right.
So if the
That's
person,
a hard thing to gauge, but interesting.
so what I would say is you can start them by just doing the range of motion,
Yeah.
see how it feels.
Right.
If that feels fine, throw on 5 pounds. If that feels fine, throw on another 5. Dose them up until you reach the point where they're actually fatiguing. The goal is to like figure out the range of motion that doesn't re-provoke their symptoms.
I was researching this a while back too, and lying pullovers seemed like a really good one for some people, and then
Sure, is like an
Kinda like-
accessory movement to pressing.
yeah, accessory, but similar to what you're talking about, just literally just testing the range that they can do, and
Right,
then
okay.
pulling over, not even pulling a band, just like using,
okay, yeah,
yeah,
sure,
just
sure,
using like a super small weight, and then same thing with the shoulder joint on the ground, like maybe in a 90-degree angle, like reaching towards the floor and pulling back in, right? I like those exercises more than sort of like typical rotator cuff exercises, because I don't know, typical rotator cuff exercises don't seem to work for everybody, especially not in the sense that they don't feel them. A lot of people say when I give them a classic, like kind of like, band internal external rotation exercise, like people don't gravitate towards that. They don't feel it.
Yep.
And I don't think it's helping. Like, and this is really one of the big like reasons why this is a great conversation to have with you, is because like those typical go-to exercises that every trainer has been told to use for things like the whole issue that we just talked about, the compound issue that we just talked about, doesn't seem to be doing anything at all.
Yeah.
So
So I have a couple of different perspectives on this. And we'll go through them in no particular order.
Sure, go for it.
The first perspective is that the role that the rotator cuff is providing to these people, like the thing that we want it to do, is to maintain centration of the humeral head.
Yeah.
So if you're not stabilizing the humeral head and then performing the activity,
Exactly.
you're so you'll see a lot of
Yeah.
people just kind of doing external rotation in that, like with that really forward, like anteriorly oriented.
But I can't get them here, so
Yeah.
at that point, what am I doing? Sounds like nothing.
Yeah, and so there are a couple of exercises that we could go over to kind of help increase their ability to provide that centration. And what I would say for most people is that most people need the right cue. I have a couple of preferred ones. So one is, those big, thick elastic bands that you have at the gym? You can imagine just wrapping that around the front of the humerus and having it physically pull the head of their humerus back while they perform the activity. So you can have that externally produced stabilization as a way to
It's an option. I don't know.
Facilitate
I don't
it.
know how I feel about doing that. I'd rather just strengthen it than so that we get shorter, and like pulled back into the socket the way it's supposed to be.
Yeah.
Because like that's longevity of the shoulder rather than just like aiding the rotator cuff and doing its work, you know? Like I want these people to bring this kind of training into their everyday lives and not have, you know, I don't know.
Yeah.
Maybe it's a different approach. Maybe it's the same. Maybe there's use cases for both.
So I think a lot of the way I think about this is less the question of like, is sort of how do we get people there the fastest?
Yeah.
And so if I'm working with a patient and I understand they want to have a certain level of overhead mobility, and I understand that they want to have a certain level of, like, it's important to them for some reason. I also understand the world that we live in. Like, there is a certain amount of time pressure. There is a certain amount of, like, hey,
inability to give that much time.
I'm taking someone's money. I'm taking their time.
Right.
I want to, as quickly and safely as I can, get them to the place where this thing is happening.
Fair.
And I think that those sort of what we'll call like capsular lengthening, because ideally what you're doing with that shoulder humeral head positioning piece is you're probably re-establishing the space in the back of their joint capsule and neurologically grooving a movement pattern where their humeral head is back and producing strength in the target tissue. And like, I can think of some floor-based exercises where I'm using a combination of gravity and posterior delt activation to manually open up that space in between training sessions.
Yeah.
I don't...
It's a both and. That's what I'm getting.
I think so. I think
it's a both and it's also a progression. Like you're going to use all of
100%.
the big stops at the beginning of somebody's procedure to get to where I'm talking about, where we can actually find that position and then start to work on it. But it's a slower road to recovery.
Yeah, and I think it's also a little bit of like a pragmatic, like, don't want to let the perfect be the enemy of the good. For some people, for whatever reason, if they have this like joint based pattern where like they really have a hard time getting back into the joint, even with appropriate cueing, even with exercises that help facilitate it, it's like, okay, so you might need a little bit of extra help and assistance. Like if we go back to the lateral raise as an exercise,
right,
it would be totally appropriate to, with the right client, let's say they can't get through a lateral raise with the full range of motion. Use a cable setup, take 5 pounds off the weight of their arm. Now they can get through a full range, fire. Right? Like, adapting the exercise to the level of progression where the person is a great way of making sure that they're able to progress.
Yeah. Cool. So, I mean, takeaways, I feel like a lot of the classic shoulder exercises that every trainer's been taught to use really don't work for this type of client because they can't get even into that position in the first place. So Peter's talking about using all of the big tools at our disposal to sort of stabilize that position first and then train the rotator cuff within that like very stabilized position. And then also kind of finding our end ranges of motion, like with the pullover, and then like kind of over time, we start to be able to let it stabilize itself, let that joint work on its own once we've done probably like a few months of this other stuff that we're talking about.
Weeks to months, probably. Yeah, like I think those exercises aren't bad. They do put load through the rotator cuff.
Sure.
My take on this is if they're part of someone's, like, there are exercises that are better done as warm-ups and as post-exercise activities. So I really prefer isometrics for warming up the shoulder, or like loaded isometrics where you're like kind of banding around someone's wrist, getting them into external rotation, getting them into that W raise position.
Yeah, people have a lot more success with those ones.
Yeah, I find they're great for facilitating a workout. they don't necessarily do as good of a job at producing growth stimulus in the target tissue or the target tendon.
Right.
And so it's one of those things where it's like, I think it's probably both and.
Yeah.
And if your goal is to produce tendon adaptation, it doesn't have to be that hard. Right? Like it doesn't have to be a very hard exercise for the force to induce tendon change. Not like muscular exercise where it's like the thing that makes you better is fatigue.
Okay. So yeah, it's not like throw them out entirely, but you know, I don't know.
At the end of workouts, as in the context of a total plan, usually also in the context of a obvious testable weakness.
Yeah, because to
Right,
go back
so
to what we were saying earlier, most people aren't activating properly because they can't even get there. So that makes way more sense to me, kind of like in terms of like sort of take them out at the beginning if somebody has that much
Positional.
Restriction, right? That's what makes more sense to me is like take them out at the beginning, bring them back when those like stabilized exercises are, you know, you're able to actually see a progression, and then do the both and then throw them back in the program.
I think
kind of
that feels reasonable to me.
Yeah.
I also think that like the work that you're so like if you're getting someone to work on a lateral raise or getting them to work on like a wall push-up or getting them to work on a landmine press versus a strict overhead press. The mechanics of these exercises, if done pain-free and with good stable technique, do all that stuff.
okay.
Right? Like all of the things in the movement.
Really, all that stuff? Because
I think facilitates it.
like, okay, because that endurance, like that deep kind of burn that you feel if you're actually you know, training the rotator cuff properly, to me that feels very different than a landmine press or something else that's still, you know, it's still doing lots of work on the joint, but that sensation to me is really different. So it's interesting that you say it's hitting a lot of the same points.
Well, I think this is interesting because I'm recognizing some of my own bias here.
Sure.
I tend to think about training movements over training tissues. And what I mean to say through that is that each movement is a symphony. You have a whole bunch of major and minor players that are helping create that, whether that's...
It's a really good soundbite. It's also very true.
Where it's like, well, you have your trunk stability, and then you have your scapular control, and then you have your humeral head control, and then you have your grip. And then
it kind of sucks to admit as a trainer, but I kind of feel like maybe they're not really like overhead pressing in the typical sense, like a strict press with the barbell isn't where we're trying to take this person.
Yeah.
Right?
Yeah. Like, I'm gonna go with the strong, yes. Or like that's a long future goal.
Oh sure. And like for me that's kind of like difficult because then it's just so much different than what they think they're coming into the gym to do, and it's different for me in terms of what I'm anticipating out of this person. I have somebody with poor shoulder mobility that's been like, she can get a barbell over her head, but like her thoracic spine is compromising every single time, and there's no amount of cueing or coaching. She's going into extension, and there's no amount of cueing or coaching that can change that. It's just not happening for her, and so I think it's just not really in the cards. Like, you know, like
is the extension painful?
No,
because I think
but it's also not. It's not a good range of motion either, though. So, you know.
Okay. So you're looking at it and you're like, oh, not only does the movement suck, but also
the range is not what it's supposed to be.
Okay.
Yeah.
In terms of like the bars in front of...
There's no like bicep to ear, like...
Yeah.
That's not happening for her. I can't do anything about it.
What happens if she grips a little wider?
Haven't tried a wider grip yet, but I don't think it would be all that much different though.
Okay.
It's just the full extension of the shoulder just isn't it's just not working. And that's just one example.
Sure.
But I think
Yeah.
there's like lots of clients that maybe the heavy strict press is not the point, right? Maybe like
Yeah.
maybe that's just not the program that I'm building. And
For that
maybe
person.
that's, maybe like, that's like a year down the line, we start to think about how to implement something that is a heavy overhead press. But for now, like, we're not going there.
Yeah.
Yeah.
I think that makes a ton of sense.
Yeah.
I think also just sort of the, what do you want? Why do you want it? Like from the client perspective.
Yeah, more
like,
goal setting specifics.
Yeah, like it.
But these people want to be strong. So for me to say
Sure.
like, hey, like we can't even track this press and this is not,
Yeah.
like for me to have to say like, you're not there yet and I have no idea when you will be. It's like, I guess it's more of a new thing for me to have to
Sure.
understand that like
Humans have limitations.
humans have limitations and that those limitations need to, be honored. And I can't just be like, here's your awesome power in your body strength training results,
Yeah.
That's just like, I don't have to necessarily do that with people as long as they understand why. I think they'll be fine with it. It's more of a me thing. Like
Yeah.
I want them to get there.
I'm like,
you know?
I'm like watching you come to
Yeah.
this acceptance
I'm
in
just
real
like,
time.
"Oh,
I'm like, I love it.
Yeah, I
It's great.
can't. Oh, it's not a barbell.
Yeah.
Like in
Yeah,
3 to 5 months kind of thing.
It doesn't have the vibe check. It doesn't
have the vibe check.
or it doesn't have the good vibes of.
That kind of sucks for me to realize, but it's also kind of true. Yeah.
Yeah, and I would. Yes, it sucks. And if we're thinking about muscular development, or we're thinking about like muscular recruitment patterns, there isn't that big of a difference between like a high incline press
Right.
and an overhead press.
Right.
There isn't that big of a recruitment difference between a landmine press and an overhead press. If this person isn't trying to do handstands,
Right.
doesn't have a life that requires them to have their arms up at exactly 90 degrees, doesn't
Yeah.
have an anatomy that allows for it.
Right.
Okay.
Can we touch on that anatomy thing? Because like after a while, right? Like I think like the bones kind of set in a certain way. Like you were talking about the shoulder and how much, whatever, 11 inch, whatever.
Yeah, that
however-
11 millimeter.
11 mil.
Yeah. 11,
Cut
11
that part, please.
11 inches is going to be so...
Cut that part, please.
That's honestly just too much.
That would be cool, though. You'd just be like, all the time.
Just-
anyway, 11 millimeters
We're
in
just
the
gonna cut
shoulder
that
joint.
immediately
We're
out of
definitely going to cut that.
context. Yeah.
It's not going in any video ever. But anyways, yes. So that.
Tell me what to do.
Like, I will. So like that, eventually that kind of sets posturally, right? So like you're saying, if they don't have a need for this in everyday life, like.
So I want to be more specific.
Okay.
That change in size of that space comes from changes in the physical nature of the bone. So when you get wrinkles on the inside, when you get age-related joint change or osteoarthritis, it's very normal for your joints to thicken. And this is just like a normal, healthy part of aging. But it's that thickening of the joint that leads to a decreased space there. The postural component, I don't think of as...
It doesn't set.
Not in an irreversible way.
But if the joint does, then
If the
wouldn't
joint
the
does, then you just
postural
have-
follow?
If the joint... So it's like, if you imagine like these two things are touching together, and over time it's now like this. So they're just taking up a bit more space betwixt each other. There is probably a posture that makes that more comfortable, or that deloads that space in a way that's more pleasant for the person.
But it doesn't seem like you could retrain that posture, because if the space is lessened and if that's more comfortable, then to that same token you wouldn't be able to retrain it.
There'll be a limit. There'll be an anatomical
It's a forever
limit to how
limitation.
much.
Yeah, it's an anatomical limitation at that stage. So that really does answer a lot of my questions. Because at that point, I'm not really focused then on like, how do I fix this person's shoulder? I'm looking at it more as like, this person's reached a stage of life where that kyphotic curve and all those other things we talked about are kind of just how they get around. And I'm not actually necessarily trying to train that out of their body,
Yeah, and I think there's a space here where it's useful to be inquisitive Like, it's useful to be like, hey, marked thoracic kyphosis, pretty stiff. Let's see if it can move better. Hey, noticing your shoulder is a little restricted. What happens when you bring it back a bit? What happens when you move towards
Because
this?
then we're screening for pain.
And also, you're probably giving this person increased capacity and quality of life as you train them.
Yeah, but I'm all down for that. I'm just
Yeah.
saying I don't necessarily have to change that on anatomical structure is going to stay.
No, you
but
don't-
like,
you don't have to
can
fix them.
can I
Yeah.
give them? Yeah, I don't have to fix them, but I can give them a little bit more range and a little bit more happiness.
Well, and some people aren't going to be able to get into that pure overhead position
Yeah.
comfortably, like
Yeah,
for whatever
see,
reason.
I always thought my job was to find that actually and bring that back, and so it's kind of good to know. It's sort of like turning it all on its head, which I actually
It's humoral head?
appreciate. What? Ha ha! Nice.
I don't know if that was
No, that was sick. I
Okay,
love
great.
that. I love that. Good.
Yeah.
Good job. Yeah, exactly. Turning it on its humoral head. We don't have to. I don't need to take that on, and that's good because I mean, yeah, I can't magically turn around. However many years of these postural things that are probably going to stick in this person's body.
And I'm imagining two different frameworks. Like, I'm imagining that there's one trainer who drives towards like perfect form in ideal lifts with all of their clients.
Yeah, I thought that was what I was supposed to do with that.
Yeah. So like, and I'm imagining
Yeah.
if you compare that trainer to the trainer who is like,
be
let's
realistic.
let's take a picture of what you can do today. What does that look like when it's better? So for the next month, we're going to work on making this better. And then on the next month, we're going to retake that picture and we're going to work on making that better. It's like the person who can kind of iteratively catch a person where they're at, give them the thing that's right on the edge of their tolerance. Like, if we're trying to get people as good as they can be as fast as possible. Like, so being able to ride that edge of like, this is going to be a thing that feels really hard, but you can do it.
Yeah.
And the person who iterates on that months on end, maybe they get the person to that big old overhead press, maybe they don't.
Yeah, maybe.
But like, it doesn't matter because then the job isn't reach this external standard. The job is accurately see this person and help them reach what they're capable of today.
Right. Can we go through a mock client of like,
Sure.
and starting with all of those things you said, and maybe adding in some, like peppering in some ideas for like how to, give this person the type of homework that they need to. Like maybe if the lat is part of the issue, right? Maybe
Sure.
like rolling or whatever. Can we, like, this is a lot for you to talk through, but
Sure.
can we start from the very beginning of this client example? And
Arms overhead. Do you ever show people shoulder cars?
yeah, I use those in warm-ups.
Yeah. So
Yeah.
I think anything warm-up based is always nice. For my purposes, I always like to check how good someone is at stabilizing the back of their humeral head, how good they are at external rotation at kind of like 90 degrees,
Okay.
or at 0 degrees and at 90 degrees.
Okay.
And so like, if I may,
Yeah.
so can I have you just scooch forward a little bit? Posture up and try to get these shoulders back a tiny bit. That's great. And so now just don't let me push your hands together. Great.
Okay.
And now up to 90 degrees. Don't let me push your hands together. Yeah. And so like that elbow flaring
Yeah.
lets me know that there's some space to improve your ability to externally rotate as you push more overhead. So that would be like knee on. So like kind of like this external rotation exercise would be a great choice for that, or doing that with a cable machine.
Okay.
The other one that I really like to check out is, so I'm going to have you hold your arm like this. I'm going to stabilize your shoulder. Don't let me pull your arm this way. And what you'll see with a lot of folks is that they'll have genuinely terrible ability to hold their arm back, especially if they already have that anterior humeral head carriage.
Right.
And so practicing that kind of like shoulder retraction or like
Well, that's rows.
posterior.
Right? We can use rows,
Rows?
for that kind of.
Yeah, and what I would say, like the focus for me would be, I'm a little worried this will look awkward,
Okay.
but it's fine. So I want you to imagine that when one is rowing, one can row in a way that is not in any way concerned about how the shoulder is moving.
Okay.
Versus one that's very concerned about how the shoulder is moving. So if you imagine, I'm not going to really work on my shoulder. I'm just going to drive my elbow up.
Okay.
You can see this line.
Yep.
And does that look pleasant?
No.
Versus if I'm driving back my shoulder, my elbow, and my wrist all at the same time.
Yeah, that's normally how I would teach someone to row. Maybe with the elbow tucked a little bit more.
Yeah. And so like that kind of modification where you're like, oh, let's focus on actually translating the humeral head back.
Yeah.
As you go through the movement. And then I think the same thing would be like if you're doing a push-up, there's that same opportunity to make sure that they're not in this position, that as they come down, they're fully driving that humeral head backwards, they're fully coming into the depth of that push-up position.
Do your traps and their like contractions make a difference? Like does the locked long thing, that phenomenon, does it shorten, does that help the humeral head if the traps are no longer locked long? Or is that less of a big deal? It seems like more so it's the lat and the shoulder and the tendon itself.
Yeah.
Is the issue.
So the way that I would describe it is that there is a tug of war between the prime movers of the shoulder, which we're going to say deltoids, pecs, lats, teres major, and the rotator cuff. So all of the other muscles that move the shoulder will like internally rotate the humerus in some way, or they'll cause humeral elevation, or they'll cause kind of anterior humeral head carriage. And the role of the rotator cuff in that tug of war is to pull everything back and hold it in place in this dynamic way.
It's a brutal tug of war though, because the sits muscles are so small.
Yeah, so it is a brutal tug of war if it wasn't for mechanical advantage.
Okay.
Right? So like all of these other muscles are designed to do more than just perturb the natural healthy carrying angle of the shoulder. They're here to move you through space, and these other muscles are here to like.
They're not actively working against the shoulder, rotator cuff at all times.
So and like if it wasn't true, what you'd see is people would have really jacked sits muscles.
What would that even look like?
I don't know.
Okay.
But like you would have a compensatory amount of development in force.
Right.
Right? Like the rotator cuff develops about as much as it does because the amount of force that it produces that is sufficient to maintain good shoulder movement is adequate for the tension.
Got it. Makes sense. Yeah, for sure.
Yeah. Where were we?
Can't remember.
Okay, great.
We're talking about a client,
yes.
talking about the progression, the necessary progression tools in somebody with multiple different shoulder issues where the rotator cuff obviously needs some
amount of engagement.
Rehab or engagement.
So if the person has really diminished capacity to maintain.
We got there from this, from this terrible capacity that most people have.
So I'd say lock 3. The lock 3 are a great set of exercises, which is lying on your stomach and doing hand extension, externally rotating, doing hand extension, and then at 90 degrees doing horizontal abdomen.
Lying on your back?
Lying on your stomach.
Oh, lying on your stomach.
Yeah.
Oh,
so you're pushing up into the air.
Yeah, absolutely.
Cut to a video of me doing that.
Absolutely. Yeah. What about like the full range of motion if they can get there?
The full range of motion is great.
But also just also pulsing, it sounds like you're saying.
Yeah, so the way that the lock 3 is normally performed is you do about 20 reps in each position. And the idea is that it just really pre-fatigues and pre-activates your
sounds
posterior
similar
deltoid.
to like YTIs, but it's like...
Yeah, not similar at all, except the focus is posterior deltoid. So you're really working on driving that humeral head back as you're doing it.
But those it's so funny because those are so underused versus the YTIs, which are just everywhere. Interesting, man. It's really helpful. As long as we get a nice, cleanly edited version that we can.
Sure.
Yeah.
I'm sure we will.
Yeah. Okay, awesome. Cool.
Yeah. So I think those, and if it's like a difficulty with external rotation, then you can either do the like knee supported external rotation, or you can do the banded W raise, where you're lifting up.
Yeah.
And you can also imagine, like, if you're imagining someone in an overhead position, and you look and you can see their elbow fully pointing in. Like, that might be fine for their anatomy, but a lot of people will find that they're a bit more comfortable if they can create just a tiny bit more external rotation in the top position.
Right.
And so building the strength to do that external rotation in top position is here.
So you have to build external rotation in front and just in all of those positions where you need it?
I'd say because, so if you were to break it up, if you're looking at how you can get a full 180 degrees of shoulder abduction,
like knock on wood, that's what we want
in a shoulder press.
Sure.
Maybe let's say a buck 85. Like let's go ham. Okay. But in 180 degrees, you have 60 degrees that happens at the sternoclavicular joint. You have 30 degrees that happens at the acromioclavicular joint. Mm-hmm. So the joint between the sternum and the clavicle, the joint between the clavicle and the shoulder blade. Mm-hmm. And then you have 90 degrees of range of motion at the glenohumeral joint, the joint between the arm bone and the shoulder blade. Mm-hmm. And so in this particular case, you only really need to be able to produce 90 degrees of external rotation strength. Mm-hmm. Because anything else that isn't that, the movement's coming from other joints that aren't part of that system. Mm-hmm. So if you can produce that external rotation here, you'll be able to produce it overhead.
Oh, cool. Wow.
Because just that's the way it goes.
Yeah, that's the primary mover of that.
Of that joint specifically, and it's a 3-joint complex that creates any shoulder pressing.
Okay, cool. So try to just break down like the preliminary, and then the like maybe we're like, I don't know, a few months down the road and we're starting to get to the point where we're overhead pressing, and then the overhead press itself, like break down just a few different exercises at 3 stages with this person. We've already touched on a lot of them. I just want to know about like where and when is the right utility for them.
Yeah, okay. So we're assuming that they're at the place where
very little is happening with their range.
But like if we were to put them on an incline bench as high as the incline bench can go, they can press into a roughly overhead type formation. If we got them we got them onto a seated bench, maybe they're like 5 degrees from being able to go forward.
Yeah.
Like from that full 180.
5 degrees, yeah, sure.
Yeah, so like there's some small deficit.
Kinda
so like
here.
They're landing here.
Yeah.
Versus landing here.
Yeah, let's say that. Yeah.
So I think technically there are a couple of really elegant ways that you can just make the biomechanics of this a little bit better. Mm-hmm. And so cable machines, obviously, really good at this particular task. Love kettlebells for this because you can let the kettlebell hang back over the wrist, and so the center of mass of the movement is over the shoulder, even though my arm is slightly forward.
Okay.
So I can develop some of the pressing mechanics, and the weight will go to the right place, even if my arm can't go as far comfortably.
Okay, so incline kettlebell bench, yeah?
No, so you could press overhead press in this way.
Yeah.
So you can just have the kettlebell hang back on your forearm.
I think with some of them, I would need them to be seated for that, though.
Yeah. So if they're doing incline, then absolutely. Yeah. The other thing that you can do is have them grab closer to the front of the weight so that the weight itself hangs back. So you'll see kind of like if you imagine the orientation of the bar, it would be more like this, so that the weight kind of like their grip is towards the part of the weight that's facing you, and the handle hangs down somewhat. So you still have that like relatively forward orientation.
It's really cool, yeah.
But like the goal is get the center of mass into the place that you want it to be, even if the shoulder can't develop that range of motion yet.
Yeah, because you're training it for like that, again, that percentage of movement that comes from that one place. So if you can get in that one place, you can get overhead. Yeah. And then what about for the client who's like, we've gone through a lot of the like preliminary steps and they're almost there?
Yeah. So for that person, it's sort of like tailoring your warm up to what their deficit is. So if their deficit is lat flexibility, well, holy crap, are we working their lat?
How do we figure that out?
So there's a really simple test where you will have the client sit with their back full against a wall and just like flat, and have them bring up their arm as high as they can. If they can't get it to that 180 degrees, then the lat's part of the picture.
Okay.
If they feel a pinch, then it's maybe rotator cuff motor control.
Okay.
Yeah.
So any pain above here is...
So basically they'll just stop. Like
Yeah.
they'll get here and they'll be like, nope, no more of that.
Okay, so how do we rule out the lat then?
That's
That's
so if they do that and
Yeah.
they can't get any further, then I'd say it's a test retest. So then I'd have them do some kind of lat stretch or lat rolling. My personal preference would be, there's a couple of really cool things that you can do with a bar on a rack that I like for the lat. The other thing that I am I find quite is just sort of like,
Oh yeah. Yeah.
yeah, like that kind of opening stretch.
Yeah.
Seems like it does a good job of getting the lat to open up enough. The other thing that someone could do, which I think is like a great prep exercise, is hanging.
Right. Okay.
Right? So like
Could you do that at the beginning?
Yeah, absolutely. Like
Yeah.
dead hang to active hang. So
Yeah,
you're
like, nice. Okay.
so and just sort of like rinsing back and forth between that for 10 reps or about a minute and a half
Mm-hmm.
can be a really great way to get, because like basically what you're doing is you're like gravity goes from the thing that's fighting you to the thing that's helping you find that position.
Mm-hmm.
So if you can't find overhead in a dead hang, well then why are we pressing there?
Yeah.
Like
sure.
that's not for you yet.
Mm-hmm.
And if you can find overhead in a dead hang, then it's like what level of progression can you use to get there?
Okay.
I would say this is me being. So this would be something that I only really use with advanced folks,
Mm-hmm.
but bottoms up kettlebell work
I was gonna ask about that actually.
for stabilizing the top position,
Mhm.
I think can be a really wonderful tool,
Mm-hmm.
and I think it can be a really wonderful tool for athletes where you like want to give them something that's challenging enough that they feel challenged,
Yeah.
so
Yeah.
that the healing process that you need to happen can still happen,
Exactly. Without.
while like not
Yeah.
underloading them.
Yeah, which would be very easy to do at their stage. Okay.
Yeah.
I mean, this has been very helpful. I think I've reached like a new understanding with this. I'm kind of excited to watch this footage back though, because I want a recap of all of it. But lots of amazing insights. It's good to still be learning about how to help people maybe not necessarily get over these things, but learn to find new ways to work with their body and keep bringing them more enjoyment out of movement. Yes.
So if someone wanted to train with you at some point,
Mm-hmm.
where would they find you?
So my company is called Liftique. We are an in-home personal training service, and you can find us at liftiquefitness.com, or you could go follow Liftique Fitness on Instagram or Facebook.
And
Yeah.
I'm assuming that this video. So I'm you can find, I'm Dr. Peter Johnson. I'm a chiropractor. You can find my info at www.drpeterjohnson.com, or you can find me at Dr. Peter Johnson on Instagram.
Cool. So
Thanks
so
for your time.
cool.
Well, yeah.
Thank you for watching.
If you like, comment, and subscribe, maybe we'll do more of this.
I would love that. Yeah, it's so helpful to have just like a wealth of knowledge. I can't express how needed that is in my day-to-day training life. But like, yeah, let's do
Thanks for the conversation.
let's do more talks. Yeah.